Welcome back to Online Pharmacy. This is you and your online pharmacist. So today's topic is topical preparations. What are these preparations? We are going to deal with this heading. What indicate top? What does mean top? Top means the uppermost layer. Topical preparation, the preparation which is going to be used on the uppermost layer, on the mucosal layer, on the skin, on the uppermost part. And the preparation which comes under this heading is ointment. The another class for this ointment is semi-solid dosage form. We also studied this ointment under the heading of semi-solid dosage form. Why? Because it is a semi-solid preparation. It contains an ointment base. The second one is the APIs, active pharmaceutical ingredients. When we are going to incorporate both of these, it forms in semi-solid form, which is ointment. What is ointment? Basically, why we are preparing this ointment? Because we have lotions, already have creams, already have emulsions, already have other topical preparations. Which is the most common dermatological preparation is the lotion. We all are aware of that. Ointments are basically of two types. The first one is medicated, the second one is non-medicated. So the one which is medicated gives a systematic effect, and the second one, which is a non-medicated, gives you what they are, both local effects and systematic effects. What is the local effect and what is the systematic effect? Okay, so the local effect is the red shirt boy. The local effect is on the uppermost area, on the uppermost part of the skin. The effect which is produced by the ointment on the topmost layer, on the outer layer, is local effect. And the effect which is produced by the drug inside the body on your systemic circulation, on your systemic system. Then what is systematic effect? What is the system? Example, you can see in this picture that the girl suffering from high blood pressure. Why this high blood pressure takes place? There are many major causes, many major effects. The first one is cardiovascular disease. Atrial are involved in this, atrial valves. Ventricular valves are also involved in this. The third one is your kidneys, because it's a main or natural purifier. And the fourth one is your brain center, medulla oblongata, which is going to be control the entire system of the blood circulation, of the blood flow, blood volume, blood pressure. So these all things are comes under the system. So this is the systematic effect. Whenever your blood pressure increases, the reason behind this is systematic effect. Okay, the following distinction is an important one with regard to dermatological application. So we have two types of dermatological applications. Which are we using to treat the skin problems? Basically, a transdermal product. What is a transdermal? As the name indicates, a transdermal product. So what is this transdermal product? This transdermal product is designed to deliver drug through the skin using a topical product, as we discussed earlier in this slide. If the patient is pregnant, if someone is pregnant or nursing, so the most caring and the most observable measure is that don't use a systematic effect drugs. The drugs having a systematic effect that going to be altered or change the systematic rhythms. Okay, so if these changes occurs in a systematic effect, the person which is pregnant, her fetus is going to be damaged. Her fetal changes occur, her nutritional damage cause abnormal growth, cause abnormalities in the fetus. Okay, so automatically the baby will be defected or maybe abnormal due to these systematic effects produced by the different drugs. What is a transdermal product? As the name indicates, dermal. Dermal means skin, and transdermal, the drug which cannot penetrate over the shallow or cannot be shallow to the skin. So the effect which is only produced on the topmost layer. So the other name is transdermal and the first one is topical. It is designed to deliver drug through the skin using topical product. Yes, the conditions we have studied, that's pregnant or nursing, because the fetal blood supply may be distracted by the use of systematic ointment. This is the most important point you have to mention in your exams also. So the ointments we prepared, cause we need a local effect. So these local effects can be produced by eye, through nasal, through vagina, and through rectal routes. Okay, so these all effects can be produced by all three routes. By placing this ointment on the surface of eye, so it can lead to your, not directly into your veins, not directly into your arteries, not directly into your veins. Okay, so you can prevent the systematic effect through nasally, by the nasal route, by through vagina. Basically, from vagina, we are using a 2 or 3 types of drug. There are suppositories, injections for edemas, basically. Inshallah, we will discuss this on our next slide. So rectally, rectal preparations are also available. Suppositories, edemas are same for rectal and vaginal. So these are very, very, very harmful or very inconvenient for the patient to take the drug through vagina or rectal. Okay, so we come towards our next heading. This is preparation. Which type of preparation? Use your therapeutic agent to contain the unmedicated ones. Yes, the most important another point is that it also contains the two, unmedicated one and medicated one. So the medicated one gives a systematic effect cause it was treating as medicine, and the unmedicated, this is unmedicated, gives a local effect. This is the local effect only on the uppermost layer, not interact with the systemic circulation. Okay, so these all are effects produced by the ointments. We come towards the inner slide. What is the classification? The systematic effect is further classified into two. The first one is antral and the second one is parenteral. As the name is similar visually, but antral and the second one also concludes par. Parenteral, that is far enter into the system, and antral through mouth, basically through oral route. So the headings come under this is oral, sublingual, rectal. What is sublingual? Sublingual is below the tongue. What is sublingual? Sublingual is below the tongue. And rectal, as we discussed in our previous slide, through rectum. So whenever we are going to give drugs from these routes, it will produce a systematic effect. And what are the oral effects? Systematic effect. What are the effects? The drug given through another route, which is inhalational, through mouth, most common. Injections also have a very, very, very broad classification. Some of them are described here. Intravenous. What is intravenous? Administered into veins, as the venous indicate veins. Second one is intramuscular. What is intramuscular? Intramuscular means injected a substance into a muscle. Basically, a muscle has major, for supposition, 3 layers. This is a rough sketch. The first one is skin. The second one is subcutaneous. And the third one is muscle, your muscle. So we are going to give in the drug in that muscle. So we have to reach the drug this level. Understand? So the next one is subcutaneous. What is subcutaneous indicates? Applied under the skin. The first layer is this is the skin. This is the skin. And we have to give the drug beneath the skin. Applied under the skin. Intraatrial. What is intraatrial? The fourth one is intraatrial. What is intraatrial? Atrial, as the name indicates, it belongs to heart, because hearts have atrial valves, have the ventricular valves, have the atria, have the ventricle. Okay, so these are related to heart. But in rare emergency, it's not a common case, except some emergencies, we can give atrial injections. Okay, the third last is intraatricular. As the name indicates, arthritis, articular arthritis, injected into the arthritis, that is for intraarticular as inflammatory parts, injection for inflammatory parts such as joints, especially in patients of rheumatoid arthritis, occasionally osteoarthritis. And the second last is intrathecal. The second one. Intrathecal, what is intrathecal? It is injected into the spinal cord. This is your spinal cord. There's another protective layer. There's also another protective layer, and there's also another protective layer. This is your spinal cord. Okay. This is your spinal cord. These are the vertebrae. Okay. These are the vertebrae. So whenever we're going to produce systematic effect much quicker, then we give intrathecal injections, where we inject the drug in this layer. Where are we going to inject? In this layer, the layer just next to the spinal cord. It reaches to the cerebrospinal fluid. So the drug reaches the cerebrospinal fluid. Basically, this is the space. We call this a subarachnoidal space. just next to the spinal fluid. Okay, this is the subarachnoidal space. Okay, we are going to use this in preparation or for injections for chemotherapy or for venous stimulations, etc. Intradermal, the last one is intradermal. You can see intradermal injection in dermis. As we have discussed the skin layers, this is the epidermis, this is the dermis, this is the hypodermis. So this is the dermis. We have to inject preparation into this layer so it can produce its desirable therapeutic effect. And local, we are talking about local effect because this is not included in our system, okay, today's topic. But the most important is local effect because we are going to produce local effect through ointments. So skin, topical effect. Intranasal, local effect. Ocular drops, ocular means eye. Mucosal throat, the throat, the nasal pipe connected with the throat. Vagina, mouth, ear. Inhalational and transdermal. They all produces the local effect, or all these organs are intended for purpose to produce a local effect. So whenever we are treating ointments or other topical preparations, so we are giving through these routes to produce a local effect and prevent the systematic problems and systematic effects. So our third slide, the next we are going to discuss is, this is the rectal and this is the nasal route. Okay, understand? Ointments. What are ointments? Ointments are semi-solid dosage form, as we have discussed. These are semi-solid dosage forms intended for external application. That is, this is the skin, and external application on the topmost layer, not beneath or under the skin. Or mucous membrane. What is the mucous membrane? On the topmost layer of the eye, the first one is the protective layer. This is the mucus. In the nasal nose, your nose also have an effective or protective layer, which is a mucous membrane. Okay, they may be medicated, as we discussed, medicated or unmedicated, used for physical effects. The physical effects may be produced by the ointment and may be used as a vehicle for medicated ointment. So we have the following categories. The first one is ointment base, oleaginous base, absorption base, water removal base, and water soluble base. As the name indicates, dissoluble in water. They may be removed through the application of water. They can be absorption base, that they can absorb water, may absorb any other ointment. Oleaginous base and ointment base, the most two importance we are going to deal with these, that's oleaginous and ointment bases. Oleaginous bases. What are oleaginous bases? These are hydrocarbon bases. What are hydrocarbon bases? As we know that ointments are applied to the skin, have an emollient effect, means softening effect. They can prevent the escape of water from the skin. They can protect your skin from the damaging or the burning light. They can prevent your skin from dehydration, and they can remain on the skin for a long period without drying out. And because of their immiscibility, what is immiscibility? They do not miscible. This is the container, it's container water, and this is the ointment. Ointment cannot be incorporated, cannot be mixed, cannot be dissolved in water, so it cannot be washed off by the application of or by the use of water. Water in aqueous preparations may be incorporated with solids, but with some difficulty. This means that these hydrocarbon bases or oleaginous bases, the second name is oleaginous base and also known as hydrocarbon base. So the hydrocarbon bases may also add water H2O with some difficulty, but it is possible to incorporate some amount, small amount or limited amount of water into these bases to prepare semi-solid dosage forms. Examples. What are the examples of this hydrocarbon base? The first is petrolatum. Okay, white petrolatum, white ointment, petrolatum, yellow ointment. As the name indicates, the ointment appears yellow, appearance is yellow. White petrolatum, appearance is white, and white ointment, it's a prepared as ointment. It may be act as a vehicle or act as a base for other active ingredient or other pharmaceutical or therapeutically effective agent. Okay, so we are going towards white petrolatum. The first heading is white petrol. Second heading is white petrolatum. What is white petrolatum? White petrolatum is a purified mixture of semi-solid hydrocarbons obtained from the petrolatum. What are hydrocarbons? The carbons or hydrogen bonding is present in the hydrocarbons obtained from petroleum. What is petroleum? Petroleum is also known as mineral oil. हम पेट्रोलियम को मिनरल ऑयल भी कहते हैं because also present naturally. So the USP, United States Pharmacopoeia. What is USP? This USP is a United States Pharmacopoeia. It is a book or pharmacopoeia which mention all the requirements, all the formulas for the preparation of ointments and their uses and what are going to be side effects or what are going to be the application characteristic of that ointment. Okay, so it is an unctuous mass range in color from yellow to light amber. You can characterize it by yellow or light amber color. It melts at 38 to 60 degrees Celsius. These all are essentials of any ointment and may be used alone in combination with other agents as an ointment base. So this indicates that white petrolatum also incorporate water and other bases. Okay. Petrolatum is also known as yellow petrolatum. It's also known as yellow petrolatum. So the appearance of yellow petrolatum is yellow and petrolatum jelly. Petroleum jelly भी हम इसे कहते हैं कि commercial products भी इसके available है market में. Vaseline के नाम से बहुत common है, आप सबके पास होगी. Vaseline is a chaser rock pound. Okay. White petrolatum USP is a purified mixture of semi-solid hydrocarbons from petroleum that has been wholly or nearly decolorized. As the yellow petroleum is of yellow color, so we cannot say that it was decolorized. But in case of white petrolatum, this is decolorized, that it cannot have any color. But you can add the color according to patient preference, according to the use, according to application, or maybe the color having some therapeutic effect. It is used for the same purpose as petrolatum, but because of his lighter color, it considered more aesthetically pleasing by some pharmacists and patients. Yes, the most important. Whenever you are applying any preparation, any mask, any face mask, any glowing mask, then you can also consider that either your clothes are not going to be messy, either the not colored is present. So these are the most important, that patients can easily use the white colored ointment without any hesitation, without any colored thought, when without any maceration. Okay, so this is very important. Please and effect for white pharmaceutical ointment. Reviews. This is the white ointment and this is the yellow ointment for your reviews. What are commercial preparation available in market? Yes, the hydrocarbon basis, oleaginous basis or oleaginous ointments. Commercial preparation is also available in market. So the first one commercial product is white Vaseline. The most important petroleum jelly is present in all of your homes and your accessory cabinet. Okay, so the yellow ointment USP has the following formula for the preparation. Whenever you are going to prepare 1000 grams of ointment, you need a yellow wax 50 gram and a petrolatum 950 grams. This is the commercial preparation. How could you mix? How could you be able to get the semi-solid dosage form, and how you would be able to obey USPs to United States Pharmacopoeia's characteristics or their desired features. So there is also a method of preparation which is registered or which is present in the USP United States Pharmacopoeia. So for the 1000 gram of ointment, the method which we are going to follow is this. Yellow wax is purified wax obtained from the honeycomb of the Apis mellifera. This is an additional information for you to gain an extra marker, to gain your good space in your exam. So the yellow wax is purified wax. From where you can obtain it? From honeycomb of the Apis mellifera. Apis mellifera is the name or the class species of the fly of the bee. Okay, the ointment prepared by melting down the yellow wax. You have to melt down the yellow wax, which is of 50 gram, which we take in 50 grams. Okay, in the water bath must have temperature of 100 degree centigrade. Adding the petrolatum until the mixture is uniform. Add the petrolatum, the second ingredient. The first ingredient is yellow wax. Mix both of these substances and melt. Mixture is uniform. Then cooling and stir. Cool करें दोनों ingredients को, stir करें. Stir means mix continuously stirring until it congealed. Congealed means they can compactly bind to each other. It is also called a simple ointment. Simple ointment भी हम इसको कहते हैं, किसको? Yellow wax को. It is slightly greater viscosity than plain petrolatum. Plain petrolatum is used by the pharmacist for the ease or for the convenience of the patient, but the market product is simple ointment, which everyone can use and present OTC over the counter. Okay, it is a slightly greater viscosity. White Petrolatum USP ointment, the first yellow ointment by substitution of wax, white wax, bleached and purified yellow wax, and white petrolatum in the formula. White petrolatum where from you obtained? From yellow ointment by substitution of white wax, bleached and purified yellow wax, and white petrolatum in the formula. You can also convert the yellow ointment into white wax by bleaching and purifying the yellow wax, and white petrolatum added into the formula of white petrolatum USP. So the remaining three slides or the remaining three headings are this: white ointment, the petrolatum, the yellow ointment. Okay, the remaining headings will discussed in the next lecture, inshallah. See you. Please do subscribe and share for more lectures from Motivate Me. Thank you so much, guys. Stay blessed, stay aware.